I learned about this project actually through the BSSC at McMaster. So I applied, I thought it was very interesting. I also am very passionate about mental health, especially when it comes to racialized communities. So I found that this was like a really good opportunity to kind of be a part of.
The Black Student Success Center for McMaster, they posted it as like a job ad for a research project. And I just wanted to do something other than just school life. I wanted to be a part of something a little bit bigger than just McMaster itself. So I thought it was a great opportunity.
The youth engagement team is comprised of the four of us, me, Zay, Ashley, and Ricardo. We were all undergraduate students at the time, and we all came in with different skill sets.
The overall purpose was just to learn about learn more about what Black mental health is and how we can actually be able to get youth connected to services, what services they need, what services they find are lacking, just kind of get a fuller picture of what that is and what that looks like in Hamilton.
So our job was mainly just outreach and finding the participants around Hamilton to try to get them to participate. We needed 50 participants from 18 to 30, that age group around for youth in Hamilton.
Dr. Waldron gave us a lot of helpful information about what the project was about, some scripts on how we were going to kind of explain the project to people. So after that, we kind of had to decide how we're going to go about that. So we split ourselves up into different roles within the youth engagement leaders.
I think we were successful at working as a team. I really liked the way that the four of us were able to mesh together. You know, we all came with different skill sets.
We really wanted to kind of brand the study in a certain way just to get young people as attracted as possible, because this is a study for young people. But we couldn't be as involved with the branding of the project just because we weren't as involved with the ethics process beforehand.
We weren't able to fully make it our own from day one, and also the ways we wanted to reach out, it was a little bit different. So that made our job a little bit more difficult. But through some trial and error, we figured it out with the right path to take.
If an opportunity was to come again, that, you know, having the creative people, which in this case, like for this study, it's us four and Ian, it probably would have been better to have us, you know, join in with that part and speak to the head directors and say, you know, we really like this, but if there's any way that we could incorporate this creatively, I feel like that would have been a little bit better.
Well, I guess another issue or a challenge was kind of just finding a process to actually recruit some of the members from the community to participate in the study. So our team kind of came up with a Google form process where we had a QR code on a lot of the posters that we had. So folks could easily kind of tap into that QR code, get connected to the Google form, and they could fill out their demographic information, and then we'd be able to see if they were a good fit for the study.
It's true, like there isn't that many resources available for Black youth, and because mental health is very stigmatized within the Black community, these kind of conversations are not really being had, and with that, those resources are not in place. So it's very important to talk about these things so then we can actually make change within the community, and also to see like Black people access mental health care that they deserve.
Mental health is a conversation that's very deep. So we kind of wanted to shift that feeling a little bit and change it from one that is negatively viewed to one where it's an opportunity to thrive, and it's an opportunity to see and learn and better oneself.
So just by having a study that's kind of normalizing these types of conversations is really valuable. And also, I know the study is really adamant on trying to find ways to kind of bridge the gaps that people are experiencing with accessing mental health services. So I really see that as a positive outcome of this study, is that they're going to identify what the gaps are from the youth themselves and try to find ways to, you know, communicate this with policy members so that they can actually get the services that they need.
I really think community-based research is very important, and it's also like very unique as well because it allows prolonged relationship even after the project is there. I'm sure that these relationships are still going to be had and these conversations are needed. So I definitely would do this again. I think it was a very good experience that I've been a part of.